My name's Dr. James Weiner, W-I-N-E-R. I'm director of the Weiner Wellness Center, located at 2419 Baldwick Road, Pittsburgh, Pennsylvania, 15205. Our phone number 412-922-WELL or 412-922-9355. We have a website at drweiner.com. You can sign up for our email newsletter. A lot of great information there. Also Facebook at facebook.com, Weiner Wellness Center, W-I-N-E-R Wellness Center, and you can like us on Facebook, and if you ask to be a friend, then you'll get our postings sent to your Facebook page. We're also on Twitter at twitter.com. Our address there is Dr. James Weiner. You can follow us for free on Twitter. And of course, if you sign up for the email newsletter on drweiner.com, we'll send you out free information to your email address. How many people have a so-called autoimmune disease? Anyone here? Do you know what an autoimmune disease is? There is no such thing. Yeah, there is no such thing, right. Yeah, this gentleman said when the body attacks itself, there is no such thing. Okay, one of the distinguishing characteristics or principles between what I talk about and the medical paradigm or conceptual framework is that I say the body's always doing the right thing, and they say that they don't understand why the body's doing things, and so what they do is they treat symptoms with drugs and surgery. For example, if you get a fever, the medical doctors want to lower the fever. I say raise the fever, because the fever is the body's attempt to kill off bacteria, viruses, and cancer by raising the body temperature. So what you do if you don't feel well, I would say pile on a bunch of blankets and assist the body in killing off whatever it's trying to kill off. If you have fluid in the knee, the doctors want to drain that knee. I say leave the fluid there because it's cushioning an injury and also providing nutrients to rebuild whatever's damaged. So we do not want to treat the symptom. We don't want to kill the messenger. If you're driving an automobile down the road and the red light comes on the dashboard signaling that the engine's overheating, if you gave that car to a medical doctor, what would he or she do? They treat the red light. They would maybe rub some salve on it, maybe rub some ibuprofen on it, or maybe a prednisone or a cortisone cream. Maybe they take a black magic marker, cover it over, and maybe they punch it out. That'd be like surgery. But of course, that's absurd. What you do is that's your car's warning signal that there's something wrong, and you go to a mechanic, and he or she's going to figure out why the red light's coming on. And it could be a leaky water pump or a broken fan belt or a hole in the radiator, and they're going to fix those parts, and the engine stops overheating. The red light goes out without them ever touching the red light. So when you have a pain, or you have diarrhea or constipation or bloating or headaches or irregular heartbeat or mood swings, whatever it happens to be, a rash on your skin, that's your body trying to tell you that something is wrong. And so the solution is not to suppress the warning signals. The solution is to try to figure out what the body's trying to tell you. Now, does anyone here have digestive problems at all? Okay, one gentleman admits to it. How many people here are on medications of some sort or another, either prescription or over-the-counter medications? Okay. Now, you know, in America, we're only 4% of the world's human population, yet we consume 75% of the world's drugs, and we're 72nd in health. We spend twice as much per person on health care as any other nation in the world, and yet we're the sickest nation among industrialized countries and as well as among some so-called underdeveloped countries. This is a very sick country, and it's getting worse. The insurance basically promotes illness. They promote the conventional medical model of treating symptoms with drugs. And we have a deplorable lifestyle. Most people are not eating enough fruits and vegetables. The average person's eating the equivalent of a fast food meal every day. You have a government which is very lax, very little regulation. And that's because of the way we allow our elections to be run, where the candidates are allowed to spend vast sums of money to get elected by buying radio and television advertising and doing endless mailings. Elections are not like this in other modern countries. In most modern countries, they're not allowed to advertise. And so the difference is that you have the best government money can buy. In order to become a senator or a congressman, it takes millions and millions of dollars. To become president, it takes hundreds of millions of dollars. And this money largely comes from corporations and special interests that do not have the welfare of the citizens in mind. We have genetically modified food. We have plants that manufacture their own pesticides that kill insects by ruining their digestive tract. Now what happens when you eat those genetically modified foods? They injure your digestive tract. There's a wonderful video on youtube.com, youtube.com, called Genetic Roulette. Anyone that has access to a computer should watch that video, Genetic Roulette. We have the promiscuous overuse of antibiotics among human beings. Every time you have anything wrong with you, they throw antibiotics at you. Very often they throw prednisone or cortisone, or both. If you have an infection, they actually don't only give you antibiotics, which do not work against viruses. So if you have a flu or a cold, it's not going to help you. But they also very often will recommend prednisone or cortisone, which actually suppresses your own immune system and prolongs the agony. You have children that have food allergies, especially to dairy products, and so they get what is mislabeled as an ear infection, and then they give kids antibiotics, and studies have shown that children that are treated with antibiotics do not heal any faster than children without the antibiotics if they have an ear problem. These are self-resolving conditions, usually caused by food sensitivities causing excessive mucus in the ear. People are on these antibiotics and prednisone and cortisone, and that kills off the good bacteria in your intestinal tract. Yes, you have good bacteria. The average adult should have about 5 pounds of good bacteria called probiotics. Now in Europe, they understand this, and when they do prescribe antibiotics, they also prescribe probiotics or prebiotics like SBC or probiotics. In America, most of the doctors don't understand this, and that's why people get what's mislabeled as C. diff, or Clostridium difficile. What they do is they'll culture you and they'll say, wow, you have this bacteria in your intestines now called C. diff. Well, guess what? You always had C. diff. It's what's called a commensal. It's just like your next door neighbor. You may not talk to your next door neighbor. You know, Robert Frost, the poet, said good fences make good neighbors, so some people choose not to get too familiar with their neighbors, but you get along with them for the most part. You know, they don't intrude on your space, you don't intrude on their space. That's a commensal. So you always have C. diff in your intestines. What happens is when you take antibiotics, it kills off all the good bacteria, some of the bad bacteria, and then you have this organism called C. diff that never caused a problem before in your intestines, and it's the last bacteria standing. So it's called difficile, from the French meaning difficult, because it's not going to be killed off by bacteria, but it doesn't, by antibiotics, but it doesn't need to be killed off by antibiotics because it's there anyhow. But they presume that's what causes the diarrhea, the gas bloating, and in thousands of cases, death every year in the United States. What these people have is a fungal infection or dysbiosis, a lack of good bacteria. Now, a lot of people get this, and they're not even taking antibiotics or prednisone or cortisone directly. They're getting indirectly from the foods they're eating. 70% of the antibiotics produced in the United States given to livestock. So even though there's a promiscuous overuse of antibiotics, when people have colds and flus, that would never help them. The majority of the antibiotics is actually given to livestock to fatten them up or prevent all the diseases that they are subject to because of their poor living conditions. And then when you eat their meat or you drink their milk, you end up getting all these antibiotics. How about tap water? Dr. Honigman gave a great talk yesterday talking about the medications in your tap water. Now, I happen to live in the eastern part of the city. We get the water from the Aspinwall treatment plant, which was built in the 1880s. Most medications that are used today were developed, invented in the last 20 years. They did not have these medications 100, 120 years ago when they built that plant. They have no way to take out these chemicals. And so there are thousands of undesirable, unintentional chemicals in your water, including all kinds of medications, male and female hormones and cholesterol medication and antibiotics and prednisone and cortisone. Just another source of things that can damage your digestive tract. Anyone here on antacids?
Nexium, trying to get
Nexium,
off.
okay, well you need to come here and get the hiatal hernia maneuver, because if you have a digestive problem, very often the medical doctors think you need to stop your digestion with antacids like Nexium, Prilosec, Protonix, Acifex, maybe over-the-counter things like Tums. You're actually going to stop your digestion, and that can cause irritable bowel syndrome, colitis, Crohn's disease, gastroparesis, something I'm hearing more and more about now, people having. They get this label gastroparesis, which means the stomach won't empty out because the food's not getting digested. How about bone loss from these drugs? We have articles on that spindle where we have that turnstile metal shelf over there near the free food. And we have articles there about the hazards of antacids. We also have a whole packet on hiatal hernia or acid reflux, because the vast majority of people that have acid reflux have the acid going up into their esophagus because their stomach's in the wrong place. The stomach acid's in the wrong place because the stomach's in the wrong place, and that is a mechanical problem, should not be treated chemically. It can be corrected in many cases with the hiatal hernia maneuver we do, where we pull the stomach back in place. That closes the flap that separates the stomach from the food tube, the esophagus, and that's the end of the reflux of food and the antacids. Millions of people are having all kinds of problems from taking these antacids. So there's all kinds of problems going on. You got the genetically modified food, you got the antacids, you got the prednisone, you got the cortisone. Many other medications also inhibit or interfere with digestion. Keep in mind, what medications do in most cases is not assist your body in functioning, it interferes with your body's functioning. It's like if the smoke detector goes off in your house and you puncture your eardrum so you don't hear it ringing. I mean, this is basically what's going on. So there are pathways that are common to a lot of different chemical processes in the body. And just imagine if you were coming here from downtown Pittsburgh and you took I-376. And let's say there was a problem at the Parkway Center exit. But instead of just closing off that exit, they shut off the entire freeway from the exit of the Fort Pitt Tunnel. So you wouldn't be able to get to Robinson, Green Tree, Carnegie, the airport. That's kind of the concept. When you take these drugs, they interfere with all kinds of common pathways, and then that's called side effects. Suddenly you have problems with other organ systems, totally unrelated to the symptom at hand. And so you get all these so-called new symptoms or side effects because they're interfering with the body's natural functioning. I had a nurse in here who works at a dialysis center that's an artificial kidney machine for people whose kidneys are failing or have failed and they can't purify their blood. I asked her what percentage of people are on kidney dialysis as a result of their kidneys being damaged or ruined by medications. 90%, she said. People on metformin for sugar diabetes. Many of these medications are ruining the functioning of your vital organs. If you watch commercial television, you can't get through 10 minutes of commercial television without seeing a drug ad. Try to pay attention to the side effects. Toe fungus, they recommend Lamisil. Side effect can be death, liver failure. I think I'd rather have the toe fungus. Now, they don't tell you that you could use about 5 cents worth of bleach to get rid of that toe fungus. You know, when I was a kid, I went to day camp, and they would take us to one or another of the public parks here in the Pittsburgh region, and in order to go to the swimming pool, once you change into your bathing suit in the locker room, you had to walk through this wading pool that had a strong amount of bleach in it because that would kill off toe fungus. But there's a maxim that you should remember. In modern medicine, they never use a less profitable procedure or product when there's a more profitable procedure or product available. Now, a few years ago, they had the avian flu scare. They said everyone's going to get the avian flu. Well, I remember the movie Birdman of Alcatraz, starring Burt Reynolds, about a true story of a prison inmate in Alcatraz in San Francisco Bay who started raising birds. In fact, he became one of the leading bird experts in the world. And he was curing avian flu with hydrogen peroxide that you get in the drugstore for $1. Ebola now is the big scare. In fact, when I was watching the election returns, they had a trailer at the bottom saying that 60% of the people in the United States felt that the government was not doing enough about Ebola. At that time, there were a total of 2 cases of Ebola in the United States out of 320 million people. So people can be very easily swayed by fear tactics on television. Ebola is totally curable with hydrogen peroxide. They don't want you to know that because you cannot patent hydrogen peroxide. They want to try to come up with some vaccine or some drug that they can make a fortune on. In the United States, there is no price control on medications, another reflection of who's running the government. Let me give you a few examples. We had a staff member here whose relative was visiting from the Middle East. And he didn't feel well, so he went one of these Med Express places, and the doctor prescribed an antibiotic. When he went to the drugstore here, it was $380 for 10 pills. He faxed the prescription to Syria. He ended up getting the identical medication for $17 instead of $380. He couldn't believe it was the same medication, so he went back to the medical doctor, and the medical doctor looked at the package. He said, "This is exactly it. It's an antibiotic manufactured in France. This is what it would look like if you bought it here at a local drugstore." $17 in Syria, $380 here in the United States. I have a friend who's on Lipitor. He happens to be a medical doctor. I can't talk him out of it. I do have him on coenzyme Q10 to try to offset some of the damaging side effects of the Lipitor cholesterol medication. The pill was $3 a pill here. He gets a year's supply from India for $20. So he can get a year's supply for what he would pay for less than a week here in the United States. Because these other countries have price controls. But here in the United States, this is the big oasis, the big cash cow for pharmaceuticals because you have the government being controlled by the pharmaceutical industry, and so there's no laws to curb the excessive profits, 10,000%, 20,000%, 30,000%. Okay, so let's say you have digestive problems, and you go to a specialist, a gastroenterologist. Do you think this doctor is going to ask you anything about your diet?
Not.
Now, what is the digestive system? The mouth, the esophagus, the stomach, the small and large intestine. That's basically a tube through which you have hundreds of pounds of food pass through you every single month. Would it stand to reason that maybe something going through that tube, running through that tube, whether it's your esophagus, stomach, or small and large intestine, might have something to do with digestive problems? They say that food has nothing to do with digestive problems. So here's what they're going to do. They're going to do a bunch of expensive tests on you. These tests don't have to be expensive, but they are, and I'll explain that in a second. And then they're going to come up with a diagnosis. They're going to put a label on it, like colitis or Crohn's disease or irritable bowel syndrome. They might have you do an MRI for $3,500 or a CAT scan for $3,500. Do you know that the hospitals pay off the cost of the equipment in 2 to 3 weeks because they charge something like $3,500 a test? What if they only charge $300 a test? Well, then they'd pay it off in a few months rather than a few weeks. But they can charge $3,500 because most people have insurance that will cover part of that cost. And then what do? Well, they might do an endoscopy where they stick a tube down your mouth into your esophagus. I have had friends and relatives who died from that procedure because they ripped their esophagus, and the esophagus generally will not heal. Okay? How about a colonoscopy where they shove a tube up the other end? I've had patients who had perforated intestines from that. So these are dangerous procedures. And then they're going to put the label on it, colitis, Crohn's disease, irritable bowel syndrome, whatever. And you think, well, they know what I have now. No, they don't, because they're not looking at the causation of why you have this disease symptom label. It's a label. So if you had 20 people in the waiting room of that specialist and they all have the same label of irritable bowel syndrome, guess what? They might have completely different reasons for why they have that problem, but they're all going to be treated with one of 5 or 10 same drugs. Maybe Acecol or Pentasa or prednisone or cortisone, Remicade, et cetera, et cetera, et cetera. And then, of course, they're going to start having the so-called side effects of those medications. In the case of Acecol, a leading cause of kidney failure, and then they'll go to one of those dialysis centers for the rest of their life. If they're on prednisone or cortisone or antibiotics, they're going to develop fungal infections in the intestinal tract where they've killed off all the good bacteria. And then if the doctor's misdiagnosis of this C. diff that I talked about, they're going to give you more antibiotics rather than probiotics. They've killed off the good bacteria, and now they're trying to kill off the harmless bacteria, the C. diff. They may give you these dangerous anti-inflammatory drugs because they say you have inflammatory bowel disease. What, pray tell, is causing the inflammation? Could it possibly be foods that are rubbing against the intestines and causing an irritation? How about if you took sandpaper and rubbed your eyeball? Do you think you'd get an irritation?
Yeah.
So what if you're eating foods that either physically or chemically irritate the inside of your intestines? They say that food has nothing to do with it. So they're treating the symptoms, they're ignoring the cause. In fact, there's this term called idiopathic, which means they don't know the cause. And this is most diseases whether it's high blood pressure or cancer or irritable bowel syndrome, and they don't know the cause because they're not looking for the cause, because the cause is irrelevant to the treatment that they do. Their treatments are not designed to correct the cause of the problem. Their treatment is designed to suppress the symptoms.
What's your last name? I'll find your bag.
The pharmaceutical companies are not in the business of healing. They're in the business of making money.
Okay.
Hospitals are not healing centers.
I'll just put this here.
They're profit centers.
I'll put your name on it so that way she knows.
The whole thing is based on profit. In the United States, we're spending twice as much per person on health care as anywhere else in the world, and yet we're 72nd in health. This system's not working because it's based on a wrong premise. If you start with a wrong premise, you end up with a wrong conclusion. Okay? If you think that you cannot figure out the cause of a problem and what you need to do is interfere with the body's natural functioning in order to suppress symptoms, you're going to end up with very sick people. So we have some strategies to address the causation of your problems. Now, we gave you 2 handouts. One is called GI Solutions. First of all, a lot of people do have injury to their digestive tracts, and so we've come up with a product called GI Complete. It comes in pills or powder, and it has ingredients, natural ingredients, that actually help heal the intestines. What a concept. Healing rather than treating. GI Complete.
I take that.
Okay. Now, in addition to that, we know that most people don't have enough good bacteria. Either they've been consuming prednisone or cortisone for all kinds of reasons. Maybe they were taking that for acne, or maybe they had asthma, or maybe they had a cold or a flu and wrongly were given the antibiotics for that or prednisone for that. There's all kinds of reasons. Maybe they had a sports injury, a knee injury or shoulder pain, and they were taking prednisone or cortisone. So there's a lot of reasons why people might have a lack of good bacteria, including eating contaminated meat and milk products that are loaded up with antibiotics and steroids, or drinking water, as I mentioned before. So most people will benefit from taking a probiotic. We have the Superbiotic. And anyone who has been on antibiotics or prednisone or is currently on them needs to be taking Superbiotics. Now, if you're on antibiotics orally, you need to take it a couple hours apart from the antibiotic. Otherwise, they'll just cancel each other out. We also have the Probzyme, Probzyme, and this is actually serving a dual purpose. It provides probiotics plus digestive enzymes. A lot of people over the age of 40 are on these antacids. And the trouble is, by the time you reach 40, you're not digesting your food as well as you used to, mainly because you're not making enough digestive enzymes in your body or hydrochloric acid in your body. And so it's very, very useful for people over the age of 40 to take some sort of digestive enzyme. We have the Betazyme, we have the Probzyme, Cybezyme. So these are a few of the GI solutions there. But there are other factors. One of the other factors that is totally ignored by the medical profession is food sensitivities or food allergies. And I've given you a 2-sided printout on that, listing hundreds of symptoms of possibly caused by food or environmental sensitivities. Children with attention deficit or hyperactivity, very often food allergies play a major part. People with arthritis, especially rheumatoid arthritis or scleroderma or systemic lupus, usually caused by food allergies. People with asthma, very often caused by food sensitivities. Skin rashes, and of course, digestive problems. As I said before, if you go to the specialist, they will probably never mention about food sensitivities because they weren't taught this in school. And you're going to say, why don't they learn about causation? Why don't they understand the role of food? Why aren't they taught this in school? Most medical schools are not teaching any nutrition whatsoever.
funded by the
Jamie, the CEO of Nutritional Frontiers, went to a medical school that started up about 4 or 5 years ago in eastern Pennsylvania, and he asked them point blank, how many nutrition courses do you have? None. So if food is so unimportant to human health, I would say we all stop eating. We'd save a lot of money. I'd save a lot of money. I wouldn't have to spend $7,000 during the wellness week to provide you with free vegan, vegetarian, healthy food so you get an idea of what healthy food's like. And also, if you stick around for a while for the classes and you get hungry, you don't have to run out and try to forage for food. We have the food right here so you can stick around and eat and stay around. I would save a lot of money. You know, I go to Whole Foods, I call that place Whole Paycheck. You know, it's expensive to get healthy food. We would all save a lot of time and money. You wouldn't have to buy cookwares, you wouldn't have to remodel your kitchen, you wouldn't have to have a kitchen. Right? So I guess food, according to the medical doctors, has nothing to do with your health because they learn nothing about it in school. And they'll tell you silly things like eat whatever you want. You have arthritis, you have bone loss, you go to the doctor, so they ask you if you're drinking soda pop with a phosphoric and carbonic acid that leaches out all your minerals and causes arthritis and bone loss. No, they're not talking anything about that. I have pictures on the wall here from my dentist, Dr. Warren. 17-year-old kid, teeth rotting from drinking soda pop, 17 years old. But they think that food has nothing to do with your health, and this gentleman's correct. He happened to mention a minute or two ago. It's all about the funding of medical schools. Where does the funding come? 90% comes from drug companies. The drug companies don't want you well because if you're well, you have no rationale for taking medication. They want you to have symptoms. So they do not want the doctors learning about health, what actually promotes health. They want to talk about treatment of disease. And so medical doctors go through school and they learn the names of all these different disease labels and what drugs to use to suppress the symptoms of these various diseases. So when you go to a medical doctor, that's what he or she is. They're pushing medicine, that's all they know. So if you have gastrointestinal problems, digestive problems, they're not going to look whether you have food sensitivities or whether you have a fungal problem. They're not going to ask you about your diet. And therefore, you're not going to get well. They'll tell you things like you need to be on this medication the rest of your life. Why is that? Because the medication doesn't work. You know what I mean? Just think about it. Let's say you had a heating or air conditioning problem in your home, and you call up a heating air conditioning person, they come over and they say, well, I need to come here every day or I need to come here every week because this is not fixable. We'll just keep coming all the time. I mean, that'd be absurd, right? And yet people keep going to medical doctors and keep taking the medications and thinking they have to be on these medications the rest of their life. Now, we're not telling you to get off medications cold turkey. That can be dangerous. What we're saying is we talk about healing. We try to get to the underlying cause of your problems. Let's talk about worms and parasites. Now, when I went to school, we had an entire semester course on worms and parasites. It was 4 hours a week for a whole semester. What we learned then was about hundreds of different infectious organisms. And we were told this is mainly a problem of third world, underdeveloped, and tropical countries. However, in the New York Times, on the front cover, several years ago, there was an entire front page story above the centerfold about how parasites are now a major health problem in the United States. Why? Because our food is coming from those third world countries, it's coming from those tropical countries. And the worms, the worm eggs are inside that food. And when you eat it, you end up getting these worms and parasites hatching inside your digestive tract. And sometimes they can go to other organs like the liver and the lungs. So this is another thing that is totally undiagnosed by most medical doctors, including the so-called specialist gastroenterologists. So we've developed a product. It's called ParaCleanse, P-A-R-A-C-L-E-A-N-S-E. And this is very effective for people that have infestations of worms or organisms. And we recommend 3 twice a day with water between meals. Now you're going to say, how do I know if I have food allergies? How do I know if I have a dysbiosis or fungal infections in the intestinal tract? How do I know if I have parasites? Well, that's where we come in, because when you come in, we evaluate you various ways, and we can try to determine whether or not one of these others is a factor in your digestive problems. With the acid reflux, as I mentioned, we have the hilar hernia maneuver. And we have various other ways, either equipment or what we call muscle testing, various ways of trying to determine, to make a differential diagnosis, not to put a label on your symptoms, a generalized blanket label. We try to figure out what's causing your problems, and different people are going to have the same symptoms for completely different reasons. So not everyone that has the label of colitis or Crohn's disease or irritable bowel syndrome has the same causation. Just like headaches. We can think about headaches. You could have a headache because you have a brain tumor. You can have a headache because you have a misaligned vertebrae. You can have a headache because you have food allergies or low blood sugar, or maybe too much caffeine or alcohol, or tight muscles, or maybe you need eyeglasses. There's a lot of different reasons why people can get a headache. There's a lot of different reasons why people can get irritable bowel syndrome or Crohn's disease or colitis or digestive upset or, slow transit time, gastroparesis or diarrhea or gas or bloating or constipation. So we have to figure out, and I've given you some of the reasons today: food sensitivities, parasite infestations, fungal infections, lack of digestive enzymes, some of the reasons why you might have problems. I also mentioned about genetically modified food, that you might be eating what you think is healthy food, but the genetically modified organisms are causing problems. We didn't even get into food combinations, which is another whole concept, that not all foods digest the same way, and they may not be compatible if you eat them at the same time. A lot of different factors involved. Medications that you're taking that could interfere with digestion, a history of antibiotics or prednisone or cortisone, or if you're on antacids, which will stop your digestion. So there's a lot of different factors involved. So I hope you've enjoyed the presentation. What we're going to do now is take questions, and I'll try to answer your questions. You don't have to limit yourself to digestive problems. So who would like to ask me some questions? I think you're all suffering from a lack of curiosity. That's a line from The Sound of Music. You ever saw that movie?
As far as the enzymes, which is the best one to take?
Well, it's an individual choice, and I would say Probzyme's a good place to start because that gives you digestive enzymes and probiotics. Yes, ma'am.
Drinking silk.
I'm sorry, what?
I've been drinking silk almond milk
You're drinking almond milk
with coconut.
and with coconut.
I heard coconut is like a laxative.
She's wondering if coconut's a laxative. It hasn't caused that in many people I know, but of course anything can cause anything. This is another thing. You'll go to a medical doctor and they'll say, oh, that can't be true or something. It's just their lack of knowledge. I've found that anything can cause anything. I'm not aware that coconut milk's going to cause you to have runny stools, but now some people may have food sensitivities and that causes runny stools.
I heard that like you get a coconut, you break it open, you drink.
Mm-hmm.
That itself is like a laxative.
Well, any kind of liquid's going to help loosen up the stools. Now, do you have constipation that you're worried about a laxative, or do you have loose stools, or why are you asking this?
No, I just
Yeah.
wondering.
I don't know. Well, you've been drinking coconut milk, right?
With the silk, yeah.
Yeah. And you haven't had that problem?
It seems to be helping me go better.
Yeah, well, there you are. Now, if people are constipated, very often they have a lack of good bacteria, so I'd recommend getting something like our superbiotic. And as I say, most people over the age of 40 would benefit from taking digestive enzymes, like our Probzyme, Cybezyme, or Betazyme. Especially if someone's had their gallbladder removed, and that's one of the fad surgeries now, and they're estimating that 50% of the people who have their gallbladder removed didn't need to have it removed. And now you have a permanent problem trying to digest fats, and then I'd recommend the Betazyme. Question over here.
There's so many people with Lyme disease today,
Lyme disease.
and, for sure the medical field says that you must take the antibiotic, or there's no other way.
Yeah, well, I took a 2-day seminar in New York a few years ago with one of the leading infectious disease experts in the country. And for many people, antibiotics alone will not get rid of the Lyme disease. So, of course, nutritional support could help. Taking colloidal silver, helping your body offset the damage of the antibiotics with probiotics. And then we actually have treatments that can help get the Lyme disease out of the body. I call them functional improvement treatments. In fact, Dan is here today. And if you want to talk to Dan, he can tell you that I've helped several of his family members, several of his children, overcome Lyme disease with these functional improvement treatments. So he's here. He's working out of Jamie's office, which is near the food table.
People use it. What kind of treatment?
I call them functional improvement treatments. And we've helped his own children with it because they live in a rural area. I think they live like in a farm-type property where they're always outdoors. And so I've done these treatments that actually help the body get rid of infections. Lyme disease is a bacterial infection.
We have a friend where it keeps coming back.
Well, she has repeated problems. She has to realize the antibiotics aren't going to do it for her. And if she's on antibiotics, she needs to be on the probiotics a couple hours apart. But you can talk to Dan, and he can convince you that, yes, indeed, I have corrected that in some of his family members. Any other questions? Yes?
I did read about an article in a magazine about another type of bacteria that's related to the Lyme disease.
Okay, she said that she's read about other bacteria related to Lyme disease. Well, there's another, there's Borrelia, there's Borrelia, there's a whole bunch of different strains that kind of gets lumped under Lyme disease. Lyme disease is named for a town in New England where they first labeled this disease. The name of the town was Lyme, L-Y-M-E. But it could be transmitted by insects, and it could be a variety of bacteria that can cause this problem. It can be very serious in some cases. But we do have a treatment as well as the nutritional protocol. Also, don't forget colloidal silver is very useful in killing off bacteria. And this has been known since ancient times. The Romans had these aqueducts where they transferred water for hundreds of miles, and they would put silver bricks in their cisterns and in the aqueducts because they figured out that silver kills bacteria. In fact, silver will melt ice. If you take a piece of regular metal versus, let's say, a pure silver dollar, and you put ice on it, you're going to see the ice will melt very fast on top of a piece of silver, where it will not on regular metal. So there's a lot of interesting properties to silver, and the ancient Romans used silver to ward off the bacteria. I don't know if they knew exactly why it worked, but it is antibacterial. And so it'll work on Ebola, it'll work on all kinds of different bacteria. Yes?
On that same idea, the colloidal silver, some people say only take it for a small period of time.
Well, colloidal silver you don't want to take for years because you'll get a buildup of silver, but you can take it for a period of months. And we have the Argentine silver here, a very useful thing to have. Okay, now what we're going to do now is we're going to have our drawing. Keep in mind, if you want to contact us, our phone number is 412-922-WELL or 412-922-9355. We're on radio over 30 hours a week. Most of the radio is heard on the internet throughout the world. Also our Facebook page at Weiner Wellness Center and our website at drweiner.com. All right, so we have the free food over there. We have the literature racks. We have the health experts answering your questions. Of course, a huge sale on our products. Thanks for coming, and enjoy your day. God bless you.